Hi, good evening again, and that's me talking today about the hip pain. Last time I did start to speak about what is the possible causes of hip pain. I wanted actually to go more in detail and tell you about the knee pain problems, but all of this will be coming in the future videos. Regarding hip problems, I have seen so many patients, and I have read a lot in the literature about the possible causes and what is the treatments. From my expertise, I found so many patients as well who had already hip replacement surgery, yet they unfortunately have hip pain after the surgery. They usually think that with the hip pain problems, the surgery will be the solution for all of these pain problems, and in fact in a lot of them they get huge relief after having the total hip replacement surgery. But so after the surgery, what can be done? What you will be able to do to get rid of the pain if it stay after the hip replacement surgery? There is actually solutions, but first of all we need to know what is the cause of your hip pain. After the hip replacement surgery, we cannot do any further interventions in the joints because it was already replaced, and this is an artificial new joint. So there is no place to inject more steroids in the joint or plasma-rich platelet, all of these innovative treatments. But there is absolutely different treatment scenario and protocols for treatment. First of all, if this pain is coming from the hip itself after having total hip replacement surgery, then probably the nerves around this hip joint is irritated. And as I mentioned, these irritations will cause some irritation in the central spinal cord. It will irritate the brain. This will cause more spasm around the hip socket and the muscles, and the muscles will actually send another signal to the brain to tell there is an irritation or harm. Then the pain memory will be formed in the brain, and even when the problem is sorted, you still have pain. So this is the difficulty here. The treatment that I figured out, and I found it very, very useful, I have done so many injections and have treated so many patients with this common problem, is to inject the nerves that is going to the hip after it is replaced. And so far, I found this treatment to be very, very useful. There is other treatment protocols as well, but it will be specified to each patient and each scenario. Of course, we need to find out if this patient as well, or if you have any disc that causes this pain, if this pain coming from the hip replaced surgery or from different part, and we can plan the treatment accordingly. Now let me quickly touch base regarding the hip pain in young population. Athletes, ladies who have a lot of Pilates and a lot of exercises, and they are stretching and they're doing everything right, but they still have pain in the hip. This pain can be presented as a hip pain, or it can be as well presenting as a buttock pain. And if it's buttock pain, it could be something coming from the pelvis, or it could be something coming from the area around the buttock. So first of all, I do examine the patient, or yourself thoroughly to find out by different specific tests if this is coming from the piriformis muscle or from bursa somewhere, a gluteal bursa. Some of the muscles with ultrasound, I can find out if this muscle is irritated or not, and I can find if there is any fluid accumulated, which is called bursitis. Also, it could be the nerves in that area. It could be the something coming from the back, but this is usually rare in young population. So if you have a buttock pain, or if you have pain in the outside of your hip, please you need to see the pain consultant. You can communicate with me if you need my advice, and you can find me always through my website, which is www.paintreatment.ie. or www.paintreatment.co.uk. You can send your queries if you need to learn more about your specific situation or how I can help you, or if you need guidance on whom to contact and how to take it forward to get rid of the pain. Please do not hesitate to contact me. That's all about the hip. Do you know, next time I'm going to speak to you about knee pain, and probably in the videos after that I'm going to speak about different types of pain in the joints, including the shoulder. If you want to know more about pain problems in the joints and how to treat and deal and diagnose them, please follow me and subscribe to my channel. I think I can be of a good benefit to you. See you next time. Thank you. Bye-bye.